BC Appeals Committee come to an order, please. Good morning.
Good morning.
Before our health officer being seated, I'm going to request Ms. Nichols to lead us in pledge of allegiance of the flag of the United States of America.
I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you so much. Roll call, please.
Commissioner Matthew,
Here.
Commissioner Baker.
Here.
And Commissioner Leininger is replaced with Commissioner Lanius.
Thank you. Next is the approval of the agenda. You had an opportunity to look at any suggestions, deletions, additions.
I make a motion to approve the minutes as printed. Support.
All right, we have a motion by Commissioner Baker and seconded by Commissioner Lanius from Hillsdale. Those in favor, please say aye.
Aye.
Those opposed say no. The ayes have it. We have an agenda. Thank you. Next is public comment. I see the crowd. Anybody on the line, Mr.? No. All right. Next item, number 3, is new business. AAA fiscal 2024 annual implementation plan. And I'm going to request Director Sutter to present us the annual implementation plan. We all had an opportunity to read this, so I am guessing that you don't have to go through all 4,052 words.
Not unless you'd like a thorough page-by-page review. I was prepared to just share a few highlights, if that works for you. We are requested and required by the state's Bureau of Aging, Community Living and Supports to update the multi-year plan, which was just submitted, as you recall, last summer. That was a larger plan, established priorities for funding, established our array of services, and this is just the update for the second year of that 3-year plan. So it has some new budget figures, which the Finance Committee reviewed earlier this week, and we're pleased with it, so that's being moved forward to the full board. But we wanted to highlight some of the updates to the program development objectives with you. We're still very interested and very committed to developing an adult day program in Branch County. That has been paused due to the pandemic and many other factors, including their entire building's renovation. So now we can pick up the pace back with their administration and explore some options there. We're hoping Jane and their organization might be open to that. So that's one of our goals. We had to update that in our 2024 plan. We also updated about some of the activities surrounding our efforts to not only train staff here, but work with providers to assure that they're being trained in diversity, equity, and inclusion, and utilizing a more broad brush approach in terms of welcoming all to their agencies and to receive services. And then, you know, we also work very hard, as you know, with elder abuse prevention and awareness. So we had made an update in our program development objectives to talk about the services to victims of elder abuse program. And those efforts continue, and obviously as board members you receive those updates monthly. We're quite busy. The referrals just keep flowing in, so we're very glad to have a new staff person starting soon, which I will report more on later at our board meeting next week. But the plan, you know, as is, just establishes the new budget figures and the services and the approach that we take is very much continuation. We're not anticipating major increases or decreases in funding or special project funding. We're actually, at the end of next fiscal year, will be the end of the American Rescue Plan funds that were filtered through the Aging Network. So we'll have, you know, some sort of sunsets, if you will, for some of those special dollars. But we continue efforts in those COVID efforts as well, alongside our public health friends, so. Are there any questions, or are there any clarifications that I could offer you? There were no participants at the public hearing. I just stopped crying about it the other day, right, Becky?
Right.
It was just two of us. So that has been updated since these drafts were prepared for you. But we held the public hearing on May 8th. We were here with bells on, we had coffee, we were ready to go, but nobody showed, so. It's okay, it means there's nothing, you know, contentious or controversial. You know, we've talked about the plan yesterday in our advisory committee meeting. They formally supported the plan as well. So, you know, we're hoping that the Program Policy and Appeals Committee feels the same way and wants to move it to the full board.
Just, you know, and we've had this conversation before, you know, with that advisory board membership, and, you know, and it's really highlighted there on page 16. I said page 16 of the plan. It would be page 19 of the packet. That, you know, it's an advisory board for an aging agency, and we're heavily weighted to the under 60 age group of the membership of that, and I know we've had that conversation before. So.
Yes.
I'm not sure it's all true, because Rick Schaefer definitely over 60.
That's correct. Some of the affiliations and those people in those DHHS seats, especially, you know, some of them do fall in the category of 60 or greater.
At the top of that page, you've got a total membership of 11 members on the advisory board, and only 3 of them are age 60 and over.
So we'll continue to focus on the membership
Not
of
16,
advocates, you know, adding
Oh,
advocates
total
that are,
membership.
or
Okay.
caregivers, you know, of those 60 plus.
I should be able to, once I leave here, I am almost 60 now.
See?
You're signing up
Welcome to
early.
join.
All
Yep.
right.
I would, Mr. Chair, I would move to recommend to the full board that they approve the
They appointed him.
annual plan for the area agency on aging.
Second.
Have a second? The annual implementation plan, we have our own chair, the health agency chair, made the motion, and seconded by our Commissioner Baker from St. Joseph County. Those in favor, please say aye.
Aye.
Those opposed say no. We have a implementation plan on hand. It is passed. Thank you. Next is annual report.
Good morning.
Good morning, Health Officer.
Yeah.
Thank you.
Thank you. So, Commissioner Leininger and I had a conversation this morning, and he had a few questions. So I've asked a couple of my staff to come and address those. So, financially, we were able to provide, that's right. So it will look something like this. To add a second year, just a second year to the financial statements so that it represents where we were a year ago as well as where we are this year. So if you take a look here, not surprising that we had a reduction in revenue in 2022. A lot of COVID funding was flowing through the agency that that bumped up our total quite a bit there in '21.
Commissioner Baker, I noticed you were looking at the pictures on page 2. As a reminder, this is the annual report for the
Last year.
for the fiscal year that ended September 30th of
Right.
22. So that's why you won't see yourself or Commissioner Lanius pictured there.
Oh, correct, yes. So that's why, yeah, absolutely.
I'm so
Um,
disappointed.
So this is 10/1 of '21 through 9/30 of '22. So the majority of 2022. And so
Right,
that's,
fiscal year October.
yeah, so that's usually what we do, is take the majority of the year, then being the year that the photos represent, because it's never quite perfect, right? But this does represent that 10/1/21 through 9/30/22 year. So next year, you will see new pictures.
Just giving Teresa a hard time.
Yes, yes, so next year you'll be there,
Okay.
Mark Wiley will drop off, so.
So, yes, and so this page came, and I forget if we had talked about it at the health board last year, but I know that the question came up when the report was presented to the Hillsville County Board of Commissioners, just wanting a comparison of year over year as to, on the financial side, you know, what that revenue and expenditure was for the health agency, you know, from one year to the next, so. And, you know, and I don't know if we actually need to just, to do the graph like that, or if you just, you know, somewhere in there, if you just had those dollar figures, you know, like the gross revenue, gross expenditure the previous fiscal year. I mean, Alex, thanks for putting this together on a short notice, and I told Becky this morning, I apologize for being so late in getting these questions in. I've been trying to get ready for a graduation open house, and so.
Life gets in the way.
So yes,
Well, we can massage this a little bit more and bring you something then on Thursday next week, if that works.
yeah,
Okay.
I would suggest the pie chart for the current year and then a graph underneath it that has just the year, the dollar amounts in it. Would probably be easier to compare with the numbers side by side.
Well, you know, I'm a matchy-matchy kind of person, so, you know, one pie craft looks different than the other. I would not make them different either, so they should be, you know,
Under-
one's- yeah, so.
Fringes, are we talking retirement funds and stuff like that?
That is included in the fringe.
Okay, that makes sense then.
But what is all in the fringe? It's not just retirement.
No.
No, but it is in there, that's right.
Yeah, okay.
I have a question. The annual report, do we forward it to the entire board?
So I will go on the road after you guys approve this and bring it to your county commission meetings. So I'll be in touch with Bud Norman and Teresa Doring. I already have a date for Hillsdale for June 27th, I think the date is. So I will come to each and present it there.
And ask for $10,000 or $15,000?
Always, as you
And
know.
bring him with you.
I can certainly bring Alex with me, yeah.
Not only security for you, but
Yeah, right.
all right.
He'll help beat it off, yep. Okay, so the other things that we talked about this morning had to do with demographics, which, I'm sorry, I have to find them. Okay, so it's page 7, the unemployment rate. So Alex did get this from County Health Rankings information, and it is the correct information for that county health ranking year. I don't really know what else we can say about that.
2022, 2023 ones have came out, the unemployment's dropped back down to like 5.5%, but for 2022, the numbers in there are accurate as far as the county health rankings.
You think they're too high, I think,
Mm-hmm.
yeah. Does it make a difference that we're citing the 2022 county health rankings as our source?
That would be the, okay, so it's the 23. Okay, so those. Why do we, and Bureau of Labor and Statistics has those numbers. The Department of Technology Management and Budget has unemployment numbers. I don't remember 2022's unemployment numbers in Hillsdale County ever being at that 9% rate.
I mean, that's where the county health rankings puts it, but if you would like us to look at different data sources for some of these lines, we can certainly do that.
So where did you pull the 9.1%?
So there's an annual report called the County Health Rankings that comes out and lists lots of different data points. You can find them on our website,
Okay.
or you can just go directly out to the County Health Rankings site. It's nationwide, it's done nationwide.
But last meeting, you have indicated about that, about the ranking, it may not be absolute.
It's always a little bit data delayed. And so I suppose, I mean, I didn't get time to really dig into this, but I suppose 2022 might be slightly data delayed. I think if this is really of concern, then maybe we should look at a different data point than the county health rankings for some of this. We just need to, indicate where we're getting it from. So if you'd like us to use the state labor numbers, we can look those up.
What does it affect, I guess is what my question is.
I think,
Other than we're tied for the most unemployed counties in the, I mean, what does it affect? Does it affect anything we may pay or anything like that?
I honestly don't even know
No.
sometimes if people look at this stuff, but, I don't know.
But it
We
was,
have,
go ahead.
oh, I'm sorry. We've consistently used county health rankings for this data, through the years though, correct?
That is my understanding. Yes. Yeah, so,
My concern, last time you mentioned, here too, our median household income, 52,000 for our Branch County, our Hillsdale 55, St. Joseph 55, and Michigan as a whole 63,000. So I'm surprised that low, all these three counties. Maybe our staff need to live in Branch County to bring the percentage.
Well, it kind of doesn't add up. If you look at how Branch, Hillsdale, and St. Joe are, the median household income is higher with a higher unemployment rate than Branch. So you got Branch County, 51,000 and at 8.1% unemployment, but Hillsdale, you might as well say Hillsdale and St. Joe have an average of 55,000, but they're at 9.1% unemployment. Maybe they're getting more money in unemployment, right?
Probably.
That
Seriously,
brings
if
it-
you
that
add in all the
brings-
benefits, they probably are.
brings up their median household income, right?
well, remember, we don't pull the data.
Right.
We're using a data source.
Fair
So,
enough.
there are people that are paid to, gather and then spit this stuff back out, and we're simply, using that information and quoting it as well.
Okay, I'm not
So-
shooting the messenger.
Yeah, yeah.
It looks like it's the Robert Wood Johnson Foundation.
Yeah, that's who does the county health rankings.
Yeah, and then also.
It's funded by the
also
Robert
look
Wood
at
Johnson
Michigan.
Foundation.
Yeah, 63.
But
at
it's done in
8.1%. How
Minnesota
does this
by
add
the
up?
university over there.
You know, how does this add up?
All right, any
So-
other comments?
Well, you know, we'd like to remain consistent, obviously. But if this is truly, you know, something that you think we need to get on top of differently, you know, we will certainly look at that, so.
I would just say
Where
it'd
is
be
that at on
interesting
the,
to see what
so,
goes.
so you're saying you're pulling these from the, county health rankings
Mhm.
report? Okay, so where's that 22 report on our website?
Go to health data on the top banner,
It's
Okay.
not that, well, yeah.
and
that's
then on the
true.
right-hand side, says county health rankings. I think it's the third one down.
You okay with that?
Absolutely, bring the breakfast tomorrow.
Incidentally, you're 4 minutes or so.
Yeah, I'm hungry.
Just a side note.
I mean, this is more or less just an informal of where we stand, right?
Right, it's, you know, intended to capture the
Snapshot.
overall health, profile of our tri-county area, yeah. Yep. You know, there's lots of different data points on here, you know, we don't list them all, obviously.
Mm-hmm.
Must be the water in St. Joe.
Oh.
We're known for a lot of things.
They're a little more fertile over there,
Yeah, I don't know, it does seem, a little high, but,
Thank you so
you know,
much.
they show Michigan at 9.9% that year. That's not what we have here, though.
huh? I would say it would just be interesting to lay over another, database to see how the county health ranking data compares with another source.
Well, indeed.
And as far as the median income or household income, I don't think that's far off because we just had a census in the town of in Mendon itself for a water grant, and those numbers align pretty close to what we got right here.
Yeah.
Yeah, it should be 9.9, Alex, for Michigan, so that needs to be fixed.
Any other
Can I,
comments?
yeah, can I move on from there?
Yes,
Please.
yeah.
So, and then the other thing that we talked about this morning had to do with the communicable disease report on page 10. And so I asked Kelly to come in and explain what she's putting together. And so, could you please?
Yeah, sure. So part of our requirements for accreditation are to publish on our annual report a trending analysis of diseases in our county and an interpretation of that data. So it doesn't have to look like what's currently been shown. It's just when I started in 2019, we didn't have that on our annual reports, so I've been doing this list of confirmed cases to represent that, which I think moving forward it might change a little bit because they did add that you now need to include an interpretation of that data. So they like to see really what's trending in your area, what has the highest case counts, and then you sort of analyzing and doing a description of that on your annual report. So moving forward, it probably will look a little bit different than this. I do not include influenza cases on that. I haven't, just because influenza is reported differently. It's not individual case reporting, only if it's a pediatric mortality or a novel influenza virus. So something that wouldn't normally affect humans. I can include it if you want, because we can do whatever we want to on these pages as far as communicable disease. So I can include the influenza count on that table if you want. And then I thought I included the COVID case counts on that. I have in the years past, because there are a couple of COVID pages on there as well that show some case trends, but they don't really show numbers very well. So I can include that as well, but it's sort of similar to influenza at this point, being that it's we have home testing now. So it's not really accurately going to show the disease in our counties because not everything is being reported.
And then,
And again, I was just wondering why the difference on those numbers compared to the communicable disease report that we get every month in our packet, and instead of those two specifically being left off that, so.
Yeah, so I didn't create the report that's shown to you at the Board of Health meetings. That was already created prior to me onboarding here. And that shows you confirmed and probable data for communicable disease. And I think that's good to represent to you guys at our Board of Health meetings, because, you can kind of see some of the trends and everything. But on our annual report, I was specifically looking at purely confirmed data for people to see. So, it's really up to you guys. If you want me to include that on the annual report, it's no problem, I can do that.
Why do we do probable data, Kelly, and how is it different from confirmed data?
Well, it does show, they have to have, the probable data doesn't totally meet the confirmed definition. So it does show maybe some lab reporting that could be related to being diagnosed with that disease. It's just not a confirmed case. So maybe they didn't do all of the laboratory testing or something of that nature. But
The thing that I think back to is like if we had a foodborne outbreak that we were investigating, and we had 30 people with similar symptoms, all at the same event, all came in contact with the same food items. Some of them were sick enough that they went and received some medical attention, maybe had a stool sample collected and analyzed, but most of the people didn't do that. Most of them were sick for a couple of days, started to feel better, resolved on its own, and that was the end of it. So in that particular case, those individuals that were part of our foodborne outbreak investigation that didn't get tested would be potential probable cases because they met the definition of what we were investigating. So individuals that ate at X restaurant on this date and consumed these food items are a case. And then, so some of the people that meet that case definition may not be sick, and some that meet that case definition may be sick. So then we take all of that information to try and see if we can narrow down what organism actually caused the illness. But that's how we get to probable and sometimes confirmed. COVID made it a little bit more gray in that those over-the-counter tests that you take, they don't count.
right, they're probable cases.
The ones that count are the ones where you went to, let's say, a doctor's office or a pharmacy, or even to our testing that we were hosting here, and they swabbed it and sent it to a lab.
The PCR testing.
The PCR test counts, but all those other tests didn't count. Doesn't mean that, you didn't have COVID. I mean, you took a rapid antigen test and it, you got both lines and you had COVID, but even if you called and reported that to us, we can't count it as a confirmed case because it wasn't a PCR test. So that all falls into what's called a probable bucket. Why do we tell you that on a monthly basis? To give you, I guess, a better idea of what's really, you know, what we're seeing, what our staff is investigating. But when we do this, we were just looking at what we actually know for sure as fact and reported it that way.
Thank you. Any comments, commissioners? Teresa?
Do you want influenza added? You know, there are some confirmed influenza, but not a lot. Most of the influenza is suspect or probable.
I mean, nothing relating to too much. I have major concern. My brothers and sisters who live nearby us, every day I see 5 or 6 people every day stop and say hello. I am very concerned about certain situations in our community, I mean, farther east, southeast. I don't know how we address that, you know, as a believer, I have a different thinking, but as working with you guys, I have a other way of, I don't know how to.
But you're right, there are certain groups in our communities that treat disease differently, right? I mean, home treatments.
Yeah.
And they don't necessarily seek a medical doctor for care, and those are very unrepresented, right? You know what I'm talking about. So, yeah.
Talking to one.
Yeah, well, and that's okay, right? Everybody needs to do what makes sense for them and what's right for their family. I don't get to tell Commissioner Leininger what's right or wrong. So, yeah. But that is one of our struggles, but especially with all of our data. It doesn't completely represent everything because we just don't, not everything comes to our notice.
Yeah, it is not only in, as you all know well, it is not only Hillsdale branch, we have other counties, also pockets of citizens. I am kind of I don't have the word, just say, I am worried someday can cause serious issues health-wise. Any other?
I would maybe suggest that we at least add influenza to that. That's maybe gonna be something that we're, you know, hopefully the COVID-19 tracking goes away in that regard. But, you know, in the past, that influenza has always been one of the higher vaccine, you know, you look across the page on page 11, you know, where we're talking about immunizations that are administered, you know, and the only one broken out, you know, in prior years was influenza. You know, yes, we've got the, you know, the COVID-19 broken out there in the last couple of years, but the only other one that was, you know, looked at separately compared to all the other vaccines prior to that was that influenza vaccine. So,
Yeah, I can certainly add it on
All right, so we will make that adjustment as well for next week, Thursday. Was there anything else in the annual report there were questions about?
Well, I have one question. I don't know why Commissioner Baker's picture is better than all of us.
I'm a lot prettier, aren't I? And
Well,
you're still the chairman.
and I do want to say thank you to Commissioner Matthew and Commissioner Houts who allowed me to capture a better picture at the last Board of Health meeting. It's better than what we had borrowed from your county website.
Oh, county, that's
Yeah.
not good.
That's not good.
If you need my obituary or something, we have at home official ones.
Yeah. Yeah.
Thank you.
I think,
All right, so we have the annual report.
Move to recommend that the full board approve the annual report with those corrections and additions added as we discussed.
Support the Hillsdale Show.
All right, we have annual report is presented by our health officer, Ms. Burns, and our own chairman, who gave us a motion, and our commissioner, Lenius from Hillsdale, seconded it. And those in favor, please signify saying aye.
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 Those opposed say no. The ayes have it. We have an annual report with all the pictures and all that, few items we correction, I believe, in the future. Thank you so much for all the effort and those who helped prepare this report behind the scene, many people involved. So thank you so much. Thank you again for your leadership, Ms. Burns. And almost 3 years of suffering will be over, like our chairman mentioned earlier.
Public health emergency is over.
yes, yes it is over.
I see Laura has taken off her Lansing already.
Yes.
She didn't wait for you?
I can't go, I got, well,
Got work to do, right?
Any other? Next is public comment. Anybody on the line? No, you don't have? All right. Well, if we don't have any business,
move to adjourn.
Second.
we have,
Just like that.
we have a motion for adjournment, we have a second, we are adjourned.
I'll
Thank
let
you.
you Hillsdale boys
And
take
the
all.